Overreaching government censorship ramping up on a global scale. Dr. Tedros, the Director General of the World Health Organization, has called for more extreme and overreaching government censorship for every country on the planet.
To enhance partnership. In this vein, the development of a new binding accord between nations on pandemic prevention, preparedness, and response will be a key pillar. I hope to see negotiations move swiftly and leaders to act with ambition. This is the moment for leaders to banish the politics of populism and self-interest, which are derailing the COVID-19 response and threaten to undermine the response to the inevitable next disease X.
And there we have it. Once again, democracy is under attack by the globalist elites. As we just heard from Dr. Tedros, that democracy is getting in the way of the Get Vaccinated campaign. It's really weird to hear a doctor claim that democracy is getting in the way of science. I thought that's what science was. Asking questions, presenting new information, drawing new conclusions. You know, a thing that we used to call a debate before all this overreaching censorship. Everyone across the world can all agree that the one thing we do not need right now is more censorship, especially overreaching government censorship. We're creeping closer and closer to repeating history, where there was Saddam Hussein, Mussolini, Fidel Castro, Chairman Mao, and the Nazi regime with censorship. And we do have some even more recent examples of overreaching censorship and crushing democracy. Right now, just recently, the other day, we had Stand News from Hong Kong, the only pro-democracy news outlet, get crushed by the Communist Party in China. This call for overreaching government censorship on a global scale is something to really worry about, considering because Justin Trudeau still has not said no way to Huawei. And Huawei has been marketing their software for face recognition and voice recognition to track political dissidents. Let's take a look at what Dr. Tedros wants to censor.
And it's actually my concern, it's also our concerns as WHO. There is this narrative now going on, which is like it's milder or it's less severe.
Oh, this narrative that is true fact from two different studies, one from South Africa, where Omicron was first reported, and then another one from the UK, where it was second reported. So we have this random Yahoo sitting in the WHO headquarters trying to tell us that his science is the best science compared to the science that did the studies for the Omicron variant. Meanwhile, he didn't even do the studies because he had no access to any of the patients. These globalist elites need to realize that democracy is not dead. Canadians still have common sense. We've just been getting crushed out by a one-way narrative. From our governments just talking at us, yelling at us, and screaming at us, not listening to us. All they want to do is push their narrative. That is it.
But we're undermining the other side. At the same time, it could be dangerous.
Yeah, sure, maybe, possibly, that the Omicron variant can be more dangerous, but let's leave that to the science, real-world data, when it comes in. Censorship is not the answer. Censorship would prevent any of these science from happening and debates Now, speaking of science and real world data, let's take a look what is being generated in Canada for the Omicron variant.
Given our dramatic rise in cases, there's still no one in hospital.
And we are joined today by Dr. David Jacobs, who is the chair of the Ontario Specialist Association and the president of the Ontario Association of Radiologists. And I very much believe that his perspectives as a frontline physician are very important for the public to hear. I want to start off by giving a William Osler update. Throughout this pandemic, I have challenged our team at City Hall in the city of Brampton and the general public to look less at case numbers, but at the severity of the cases. And particularly with Omicron, what we're seeing is not as much severity of those cases, and that is playing out at Brampton Civic. Right now, there are currently 20 COVID-19 patients at Brampton Civic Hospital and only 2 in ICU. To put that into context, during the height of the third wave, we were so full at Brampton Civic, we were overrunning with COVID-19 patients. We had more COVID-19 patients at Brampton Civic than the COVID-designated hospital. At one point, we were sending 100 patients out of our hospital a week, being reassigned to different hospitals around the province. So when I say we only have 2 in ICU, it speaks to a picture that is dramatically different than what we saw in previous waves. Now, obviously, the vaccination campaign is responsible for much of that success. And I have to note, it's even more positive than it first appears when you look at those COVID numbers. Because when you look at the COVID numbers at Brampton Civic, more than 50% of the COVID patients, so of the 20 COVID-19 patients, half of them went in for COVID. But what is interesting is half of the COVID-19 patients being counted as COVID-19 patients came in for another healthcare issue and inadvertently found out that they had COVID, which speaks to the fact that COVID is so well spread in the community right now. The Omicron variant is everywhere. I had one infectious disease doctor at Osler tell me that the case counts could be 5 times what we think it is, based on the fact that there is such a degree of community spread. And so when you look at case counts like we're seeing now, that have surpassed case counts the highest case counts that we've seen before, but the hospitalization is so low, the severe cases are so low, that is a positive trend. I know right now in the media there is a lot of negativity and doom and gloom, but when you break down and you look at these numbers in the hospital, there are reasons for cautious optimism that at this point with the Omicron spread, we're not seeing the type of severity that was imagined. I would note, though, one concern that we have with our local hospital is health human resources. And so, with the current quarantine policies, there are going to be significant strains on the hospital system in terms of not having physicians that are needed to attend to patients available. And so, that is one of the more acute challenges we're facing right now. On that note, I want to invite up Dr. David Jacobs, who's someone that I have greatly admired his voice within the healthcare system in terms of speaking to the current challenges with Omicron. And he has a unique perspective, not only as a leading radiologist in the province, but as a frontline physician that when he goes to work every day, sees the realities of what COVID-19, what Omicron means in the hospital. So pleased to welcome up David Jacobs.
Thank you very much, Mayor Brown. That's really very kind words. You've given such a good summary of what we're actually seeing. I'm not sure that I have a whole lot more to add. So let me just give you a flavor for what we are seeing in the hospitals right now. And it very much reflects what Mayor Brown has just said. The emergency rooms are absolutely flooded with people with upper respiratory tract infections, but they're not converting over to COVID pneumonias as we've seen in the past. So people are feeling sick from Omicron, but they're not having the low oxygen saturations that we've seen in the past. Now, there is a proviso there. There's something that we do have to recognize, that Omicron is impacting vaccinated people much differently than it's impacting unvaccinated people. So what we are seeing is the occasional people who are getting very sick, and we can see it on their chest x-rays, they have the usual COVID pneumonia. Those people tend to be unvaccinated. So when we look at our hospital count right now in terms of the ICU, I want to mirror what Mayor Brown has said. What we're seeing are very, very low numbers. So at the height of the pandemic, we had over 25 people in the ICU, and we were shipping people out daily. Currently, we have 3 people currently in the ICU because of COVID, down from 4 yesterday. So we're moving in a nice, steady pathway, and we're not getting overwhelmed in the ICU. The ICU is our bottleneck. The next thing that I want to talk about is what are our risks to the healthcare system right now? The big risks, as Mayor Brown stated, is manpower issues. As Omicron spreads throughout the community, it impacts everyone, including hospital staff. Those hospital staff will get sick, and that will decrease our ability to service different areas, particularly the ICU, as that staff gets sick. So we have to understand that the pressure on the healthcare system isn't going to be a crush of patients, it's going to be difficulty staffing. So the last...
And there we have it, folks, some common sense in Canada. The cases have gone up, but the hospitalizations and ICU visits are down. And it's not going to be the virus and patients crushing the hospitals. It's going to be the short on staff, something that we've been having for 20 years here in Canada. It's a continuous issue, but it keeps getting blamed on Omicron or COVID and the unvaccinated, but in true fact, it is just a failure of the system starting from the management level, and that needs to be addressed. Alright everyone, that's all we have for you today. Don't forget to like this video, subscribe to the channel, and hit that notifications bell to get more.